Welcome future nurses. If you've ever felt that obstetric/maternity questions on the NCLEX are tricky or overwhelming, you are not alone. These questions can make or break your test because they cover labor and delivery, pregnancy complications, newborn care, and postpartum emergencies, the topics that NCLEX loves to test you on. But here's the good news. Today you're getting 50 of the most high-yield obstetric/maternity NCLEX questions, the ones you can't afford to miss. We're not just going through questions and answers. For each one, you'll get a clear rationale so you understand why the right answer is correct, and why the wrong ones are wrong. A proven strategy or test-taking trick to help you answer similar questions on exam day. So grab a notebook, pause when you need to, and stay with me all the way to the end, because the last few questions often trip people up, and I'll share some bonus NCLEX tips there that could save you precious points on test day. Let's dive in and make OB/maternity your NCLEX strength instead of your weakness. Question 1. A client in active labor is receiving oxytocin, Pitocin, for induction. The nurse notes contractions every 2 minutes, lasting 90 seconds, with little relaxation between them. The fetal heart rate is 170 bpm. What is the nurse's priority action? A. Increase 4 fluids. B. Stop the oxytocin infusion. C. Notify the healthcare provider. D. Reposition the mother to her left side. Correct answer, B. Stop the oxytocin infusion. Rationale. Oxytocin stimulates uterine contractions, but too much can cause uterine tachysystole, too frequent or prolonged contractions. This reduces uteroplacental perfusion, leading to fetal distress. Tachycardia, 170 bpm, is an early sign of hypoxia. Stopping oxytocin immediately removes the source of overstimulation. For fluids, A. May support perfusion but won't stop the problem. Repositioning, D. Improves circulation but is not effective if oxytocin is still running. Provider notification, C. Is important but should occur after emergency nursing measures. Strategy. On NCLEX, when a medication is causing harm, stop the drug first before calling the provider. This is fix the cause before the effect. Look for keywords like oxytocin plus abnormal FHR plus tachysystole. The immediate action equals stop infusion. Question 2. A woman at 32 weeks reports swelling of her face and hands, severe headache, and visual disturbances. Which complication should the nurse suspect? A. Gestational diabetes. B. Placenta previa. C. Preeclampsia. D. Preterm labor. Correct answer, C. Preeclampsia. Rationale. Preeclampsia is a hypertensive disorder of pregnancy associated with proteinuria, edema, and signs of CNS involvement, headaches, blurred vision. Gestational diabetes, A, presents with hyperglycemia symptoms like excessive thirst/urination, not edema plus headache. Placenta previa, B, equals painless, bright red bleeding, not neurological symptoms. Preterm labor, D, equals uterine contractions and cervical change, not swelling plus visual changes. Strategy. Look for clue words, swelling of face/hands plus headache plus vision changes equals always preeclampsia. Eliminate other conditions by matching classic symptoms, bleeding equals previa, contractions equals preterm labor, sugar equals diabetes. Question 3. A pregnant woman in her second trimester asks about dietary needs. Which statement indicates further teaching is required? A. I should increase folic acid to prevent neural tube defects. B. I will eat small, frequent meals if I get heartburn. C. I should increase calories by about 1,000 per day. D. I will include iron-rich foods like beans and leafy greens. Correct answer, C. I should increase calories by about 1,000 per day. Rationale. Pregnant women need only about 300 extra calories/day in second and third trimesters, not 1,000. Folic acid, A, prevents neural tube defects like spina bifida. Small, frequent meals, B, reduce reflux and heartburn. Iron, D, prevents maternal anemia. Strategy. NCLEX loves numbers. When you see a choice with an extreme number, double-check your knowledge. Too high, 1,000, or too low is often wrong. Remember, 300 kilocalories, 25 to 35 pounds total weight gain, 400 to 600 micrograms folic acid daily. Question 4. A nurse is caring for a postpartum woman with heavy vaginal bleeding. The uterus is boggy and deviated to the right. What is the nurse's first action? A. Massage the fundus. B. Start oxytocin infusion. C. Encourage the client to void. D. Call the healthcare provider. Correct answer, C. Encourage the client to void. Rationale. A boggy uterus usually means uterine atony, but when it is deviated to the right, this indicates bladder distension. A full bladder displaces the uterus and prevents effective contraction, leading to hemorrhage. Voiding, C, relieves pressure and allows uterus to contract. Fundal massage, A, works for atony, but won't correct displacement. Oxytocin, B, is used if massage and voiding fail. Calling provider, D, comes later if nursing measures don't work. Strategy. Know the cause if boggy and midline equals massage, if boggy and deviated equals empty bladder. On NCLEX, the first nursing action often involves something the nurse can do immediately. Question 5. A client at 39 weeks reports sudden, painless, bright red vaginal bleeding. What condition does the nurse suspect? A. Placenta previa. B. Placental abruption. C. Uterine rupture. D. Cervical laceration. Correct answer, A. Placenta previa. Rationale. Placenta previa equals placenta covers cervix painless, bright red bleeding. Placental abruption equals painful, dark red bleeding, rigid abdomen. Uterine rupture equals sudden tearing pain, fetal station change, maternal shock. Cervical laceration equals bleeding after delivery, not during pregnancy. Strategy. Use the pain versus painless rule. Previa equals painless, abruption equals painful. NCLEX often tests this distinction. Question 6. The nurse is caring for a newborn of a mother with diabetes. Which finding requires immediate intervention? A. Blood glucose 35 mg per deciliter. B. Respiratory rate 50 breaths/min. C. Heart rate 140 bpm. D. Acrocyanosis of hands and feet. Correct answer, A. Blood glucose 35 mg per deciliter. Rationale. Normal newborn glucose equals greater than 45 mg per deciliter. 35 is hypoglycemia and dangerous, can cause seizures, brain injury. RR50, B, is normal, 30 to 60. HR140, C, is normal, 110 to 160. Acrocyanosis, D, is common in first 24 hours. Strategy. Always prioritize abnormal lab values that could cause neurological damage. On NCLEX, low sugar, low calcium, or low oxygen usually come first. Question 7. A nurse assesses a newborn with respiratory distress syndrome, RDS. Which sign supports this diagnosis? A. Strong cry and pink skin. B. Grunting and nasal flaring. C. Irregular breathing during sleep. D. Acrocyanosis after birth. Correct answer, B. Grunting and nasal flaring. Rationale. RDS occurs due to surfactant deficiency, especially in preterm infants. Classic findings equals grunting, nasal flaring, retractions, cyanosis. Strong cry/pink skin equals healthy baby. Irregular breathing during sleep equals normal newborn periodic breathing. Acrocyanosis equals expected in the first day. Strategy. Look for the respiratory distress triad: grunting, flaring, retractions. Anything else is normal. Question 8. A laboring woman reports severe abdominal pain, and the nurse notes vaginal bleeding and a rigid abdomen. What complication is suspected? A. Placenta previa. B. Placental abruption. C. Preterm labor. D. Uterine rupture. Correct answer, B. Placental abruption. Rationale. Placental abruption equals premature separation of placenta, painful contractions, dark red bleeding, rigid abdomen. Previa equals painless bright bleeding. Preterm labor equals uterine contractions without bleeding. Uterine rupture equals tearing pain with sudden cessation of contractions and loss of fetal station. Strategy. Rigid abdomen plus pain plus bleeding, always think abruption. Question 9. A client at 34 weeks gestation reports sudden gush of clear fluid. What is the nurse's priority? A. Assess cervical dilation. B. Check fetal heart rate. C. Prepare for delivery. D. Insert for access. Correct answer, B. Check fetal heart rate. Rationale. Sudden fluid equals rupture of membranes, risk of cord prolapse. First priority equals check FHR to ensure no cord compression. Cervical dilation, for fluids, and preparation for delivery are secondary. Strategy. Think airway, breathing, circulation for fetus. FHR equals best indicator of fetal oxygenation. Question 10. The nurse cares for a woman in labor with a history of herpes simplex virus, HSV. She has active lesions. What is the safest delivery method? A. Vaginal delivery. B. Assisted vaginal with forceps. C. Cesarean section. D. Induction of labor. Correct answer, C. Cesarean section. Rationale. Active HSV lesions equals contraindication to vaginal delivery due to risk of neonatal herpes, which can be fatal. Vaginal delivery, A. Exposes baby to infection. Forceps, B. Increase trauma, more risk. Induction, D. Doesn't reduce transmission risk. Strategy. Always pick the safest option to prevent neonatal infection. If mom has active genital infection equals C-section. Question 11. A nurse is teaching a pregnant woman about common discomforts in the third trimester. Which statement requires further teaching? A. I can sleep on my left side to improve circulation. B. I will wear low-heeled shoes to reduce backache. C. I should lie flat on my back to relieve shortness of breath. D. I can eat small frequent meals to reduce heartburn. Correct answer, C. I should lie flat on my back to relieve shortness of breath. Rationale. Lying flat on the back in late pregnancy compresses the inferior vena cava. This decreases blood flow back to the heart, reduces cardiac output, and limits oxygen delivery to the fetus, condition known as supine hypotensive syndrome. Left side lying improves blood flow to the placenta and helps relieve discomfort. A equals correct teaching. Low-heeled shoes reduce strain on the back and help maintain balance. B equals correct teaching. Eating small frequent meals prevents gastric reflux and heartburn. D equals correct teaching. Strategy. On NCLEX, whenever you see lie flat on the back in late pregnancy, immediately think of vena cava compression, unsafe. The best position is side lying, preferably left side. Question 12. A client at 36 weeks with placenta previa is admitted. Which intervention is most important? A. Monitor fetal heart tones. B. Perform a vaginal exam. C. Place client on bed rest. D. Start 4 fluids. Correct answer, A. Monitor fetal heart tones. Rationale. Placenta previa equals placenta partially or completely covering the cervix. Main risk equals sudden painless bleeding, potential fetal distress. Vaginal exam, B, is contraindicated because it may tear the placenta and cause catastrophic hemorrhage. Bed rest, C, and 4 fluids, D, are supportive measures but do not directly address fetal well-being. Priority is to continuously monitor fetal heart tones to detect early signs of distress. Strategy. On NCLEX, if the patient has vaginal bleeding of unknown origin or placenta previa, never choose vaginal exam. The safest priority is always fetal monitoring. Question 13. A nurse is caring for a woman in the second stage of labor. She suddenly reports severe chest pain and difficulty breathing. What complication should be suspected? A. Pulmonary embolism. B. Amniotic fluid embolism. C. Placental abruption. D. Uterine rupture. Correct answer, B. Amniotic fluid embolism. Rationale. Amniotic fluid embolism, AFE, occurs when amniotic fluid enters maternal circulation. It triggers a sudden cardiovascular collapse, dyspnea, chest pain, hypotension, and possible cardiac arrest. Pulmonary embolism, A, causes similar symptoms but is usually seen postpartum and not sudden during labor. Placental abruption, C, involves painful bleeding and rigid uterus, not chest pain and breathing difficulty. Uterine rupture, D, causes abdominal pain, cessation of contractions, and fetal distress, but not acute respiratory collapse. Strategy. Key phrase for NCLEX, sudden respiratory distress during labor equals amniotic fluid embolism. Question 14. A woman at 10 weeks gestation has severe nausea and vomiting, weight loss, and dehydration. Which complication is suspected? A. Hyperemesis gravidarum. B. Morning sickness. C. Preeclampsia. D. Placenta previa. Correct answer, A. Hyperemesis gravidarum. Rationale. Hyperemesis gravidarum is severe, persistent nausea and vomiting beyond normal morning sickness. Leads to weight loss, dehydration, and electrolyte imbalance. Morning sickness, B, is mild nausea without dehydration. Preeclampsia, C, presents with hypertension, proteinuria, and edema, not vomiting. Placenta previa, D, causes painless vaginal bleeding, not GI symptoms. Strategy. If the question describes vomiting severe enough to cause weight loss and dehydration, the correct answer is hyperemesis gravidarum, not normal morning sickness. Question 15. A postpartum client complains of severe perineal pain not relieved by medication. The nurse notes a firm, bluish, swollen mass at the perineum. What is the likely cause? A. Hemorrhoids. B. Hematoma. C. Infection. D. Uterine prolapse. Correct answer, B. Hematoma. Rationale. Hematomas equals collection of blood under the skin. They appear as bluish, swollen, tense masses. The key feature is severe, unrelieved pain. Hemorrhoids are swollen veins, not tense masses, and pain is less severe. Infections cause redness, warmth, and purulent discharge, not bluish discoloration. Uterine prolapse equals downward displacement of uterus into vagina, not a perineal bulge. Strategy. NCLEX clue, pain out of proportion to findings plus bluish bulge equals hematoma. Question 16. A woman at 28 weeks is admitted with painless vaginal bleeding. What is the priority intervention? A. Apply continuous fetal monitoring. B. Insert a Foley catheter. C. Prepare for amniocentesis. D. Perform fundal massage. Correct answer, A. Apply continuous fetal monitoring. Rationale. Painless vaginal bleeding in the second or third trimester strongly suggests placenta previa. The most urgent action is to assess fetal well-being through continuous fetal monitoring. Foley catheter, B, is unrelated. Amniocentesis, C, is diagnostic, not emergency management. Fundal massage, D, is used postpartum, not during antepartum bleeding. Strategy. On NCLEX, placenta previa equals painless bleeding equals fetal monitoring priority. Question 17. A woman at 38 weeks with severe preeclampsia is prescribed magnesium sulfate. Which finding requires immediate intervention? A. Urine output 30 ml per hour. B. DTRs 2+. C. Respiratory rate 10 per minute. D. Blood pressure 150/90 mmHg. Correct answer, C. Respiratory rate 10 per minute. Rationale. Magnesium sulfate is given to prevent seizures in preeclampsia. However, toxicity can occur. Signs of toxicity equals respiratory depression, RR less than 12, absent reflexes, and oliguria, less than 30 ml per hour. A urine output of 30 milliliters per hour is the minimum acceptable, A equals okay. DTRs 2+ are normal, B equals okay. BP of 150/90 is still elevated but not life-threatening compared to respiratory depression. RR of 10 is the most dangerous finding and requires immediate action. Stop infusion, give calcium gluconate. Strategy. Memorize the magnesium sulfate toxicity triad, reflexes, urine output, respirations. Always treat respiratory depression first. Question 18. A woman in labor suddenly complains of sharp abdominal pain, contractions stop, and fetal heart rate drops. What complication is suspected? A. Placenta previa. B. Uterine rupture. C. Placental abruption. D. Cord prolapse. Correct answer, B. Uterine rupture. Rationale. Uterine rupture equals rare but catastrophic complication. Signs equal sudden tearing pain, cessation of contractions, fetal distress, and sometimes loss of fetal station. Placenta previa, A, equals painless bleeding, no severe pain. Placental abruption, C, equals painful vaginal bleeding with rigid uterus, but contractions usually continue. Cord prolapse, D, equals sudden fetal distress with variable decelerations, not maternal pain. Strategy. On NCLEX, sudden sharp pain plus contraction stop plus FHR drops equals uterine rupture. Question 19. A client is 2 hours postpartum with excessive bleeding, a soft boggy uterus, and no clots. What is the priority nursing action? A. Increase 4 fluids. B. Perform vigorous fundal massage. C. Notify the provider immediately. D. Encourage breastfeeding. Correct answer, B. Perform vigorous fundal massage. Rationale. Most common cause of postpartum hemorrhage equals uterine atony, boggy uterus. The first-line intervention equals massage the uterus until it becomes firm. This promotes uterine contraction and reduces bleeding. For fluids, A. Help replace lost volume but do not treat the cause. Notifying provider, C, is important if massage fails, but first the nurse must act. Breastfeeding, D, stimulates oxytocin release but works slower than massage. Strategy. For postpartum hemorrhage, follow the order of priority. Fundal massage. Medications, oxytocin, methergine, misoprostol. Notify provider if bleeding persists. Question 20. A nurse is caring for a newborn 30 minutes after birth. Which finding requires immediate intervention? A. Respiratory rate 45 per minute. B. Acrocyanosis of hands and feet. C. Nasal flaring and intercostal retractions. D. Heart rate 130 bpm. Correct answer, C. Nasal flaring and intercostal retractions. Question 24. During labor, the nurse notes that the amniotic fluid is green after rupture of membranes. What does this finding indicate? A. Infection. B. Meconium-stained fluid. C. Premature rupture of membranes. D. Placental insufficiency. Correct answer, B. Meconium-stained fluid. Rationale. Green amniotic fluid equals meconium passage in utero. This suggests possible fetal distress or hypoxia. Infection, A, presents with foul odor and cloudy/yellow fluid. Prom, C, is about timing of rupture, not color. Placental insufficiency, D, can cause distress but the key clue equals meconium-stained fluid. Strategy. For NCLEX, remember, green fluid equals meconium equals fetal distress risk. Next step, monitor fetal heart rate and prepare for possible resuscitation. Question 25. A postpartum client is diagnosed with mastitis. Which teaching is correct? A. Stop breastfeeding until I finish my antibiotics. B. I should continue breastfeeding from both breasts. C. I should apply ice packs for comfort. D. I need to wear a tight-fitting bra. Correct answer, B. I should continue breastfeeding from both breasts. Rationale. Mastitis is an infection of breast tissue. Treatment includes antibiotics, analgesics, warm compresses, and continuing to breastfeed to keep breasts drained. Stopping breastfeeding, A. increases milk stasis and worsens infection. Warm compresses, not ice, C. help pain and circulation. Tight bras, D. obstruct milk flow and worsen mastitis. Strategy. On NCLEX, mastitis equals antibiotics plus warm compresses plus keep breastfeeding. Question 26. Which newborn reflex is observed when the sole of the foot is stroked and the toes fan outward? A. Moro reflex. B. Babinski reflex. C. Rooting reflex. D. Grasp reflex. Correct answer, B. Babinski reflex. Rationale. Stroking the sole toes fan outward equals Babinski reflex. This is normal in newborns up to 1 year, but abnormal in adults. Moro reflex, A. equals startle reflex with sudden extension of arms. Rooting reflex, C. equals turning head toward cheek stimulation. Grasp reflex, D. equals grasping finger placed in palm. Strategy. Easy way to remember, B for Babinski, B for baby normal in babies, abnormal in adults. Question 27. A nurse assesses a woman 12 hours postpartum. Which finding is most concerning? A. Fundus firm at the umbilicus. B. Lochia rubra with small clots. C. Temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. D. Saturating a perineal pad in 15 minutes. Correct answer, D. Saturating a perineal pad in 15 minutes. Rationale. Saturating a pad in less than 1 hour is excessive bleeding and indicates postpartum hemorrhage. Fundus at the umbilicus, A. equals expected. Lochia rubra with small clots, B. equals normal early postpartum. Temp up to 100.4 degrees Fahrenheit in first 24 hours, C. is normal due to mild dehydration. Strategy. For NCLEX, any option describing heavy, rapid bleeding postpartum equals emergency. Always treat hemorrhage first. Question 28. A woman with severe preeclampsia is receiving magnesium sulfate. Which medication must be available at the bedside? A. Calcium gluconate. B. Naloxone. C. Atropine. D. Protamine sulfate. Correct answer, A. Calcium gluconate. Rationale. Antidote for magnesium sulfate toxicity equals calcium gluconate. Naloxone, B. reverses opioid overdose. Atropine, C. treats bradycardia. Protamine sulfate, D. reverses heparin. Strategy. For NCLEX drug questions, always memorize antidotes. Magnesium sulfate calcium gluconate. Heparin protamine sulfate. Warfarin vitamin K. Opioids naloxone. Question 29. A newborn has the following APGAR score at 1 minute, HR 120, weak cry, some flexion of extremities, pink body with blue hands/feet. What is the total score? A. 10. B. 8. C. 6. D. 4. Correct answer, B. 8. Rationale. APGAR breakdown. HR 122 points. Respiratory effort, weak cry, 1 point. Muscle tone, some flexion, 1 point. Reflex irritability, grimace/response, 2 points. Color, pink body, acrocyanosis, 1 point. Total equals 7 to 8, most correct equals 8. A score of 7 to 10 equals good adaptation. Strategy. Memorize APGAR scoring. 7 to 10 equals normal. 4 to 6 equals moderate distress. 0 to 3 equals severe distress. Question 30. A woman at 30 weeks presents with headache, blurred vision, and swelling of her face and hands. What condition is most likely? A. Normal pregnancy changes. B. Gestational hypertension. C. Preeclampsia. D. Placenta previa. Correct answer, C. Preeclampsia. Rationale. Preeclampsia equals new onset hypertension after 20 weeks plus proteinuria and symptoms like headache, visual changes, or edema. Normal pregnancy swelling, A, is usually mild and confined to feet/ankles, not face/hands. Gestational hypertension, B, is just elevated BP without systemic symptoms. Placenta previa, D, causes painless vaginal bleeding, not hypertension. Strategy. NCLEX shortcut, pregnant plus hypertension plus headache/vision changes plus edema equals preeclampsia. Question 31. A client at 39 weeks with suspected placenta previa is being assessed. Which nursing action is the highest priority? A. Vaginal examination for cervical dilation. B. Monitoring fetal heart tones. C. Checking for uterine contractions. D. Assessing vaginal bleeding. Correct answer, D. Assessing vaginal bleeding. Rationale. Placenta previa is when the placenta implants low in the uterus and partially or fully covers the cervical opening. The hallmark symptom is painless bright red vaginal bleeding in the third trimester. A vaginal exam, A, is dangerous, it can cause massive hemorrhage. Fetal heart tones, B, and contractions, C, are important, but the priority is recognizing bleeding and preparing for possible cesarean delivery. Strategy. On NCLEX, whenever placenta previa is suspected, never choose vaginal exam. Always think, painless bleeding equals placenta previa. Assess bleeding, stabilize mom, prepare for delivery. Question 32. A postpartum woman develops chills and fever 3 days after giving birth. Which complication is most likely? A. Endometritis. B. Mastitis. C. Normal postpartum changes. D. Urinary tract infection. Correct answer, A. Endometritis. Rationale. Endometritis is an infection of the uterine lining, and it commonly occurs 2 to 5 days postpartum. Signs include fever, chills, uterine tenderness, and foul-smelling lochia. Mastitis, B, affects breast tissue, not the uterus. Normal postpartum recovery, C, may cause a slight temperature within the first 24 hours due to dehydration, but not 3 days later. A UTI, D, would cause dysuria and urinary frequency, not uterine pain. Strategy. Memorize the timing. Fever less than 24 hours postpartum equals usually benign. Fever greater than 24 hours postpartum equals infection, most often endometritis. Question 33. A postpartum client has a firm fundus but continues to have heavy vaginal bleeding. What is the most likely cause? A. Uterine atony. B. Retained placental fragments. C. Uterine rupture. D. Coagulation disorder. Correct answer, B. Retained placental fragments. Rationale. Normally, a firm fundus indicates that the uterus is contracting and should control bleeding. If heavy bleeding continues despite a firm uterus, it suggests retained placental tissue interfering with uterine involution. Uterine atony, A, causes a boggy uterus. Uterine rupture, C, presents with sudden pain and abnormal fetal tracing during labor, not postpartum. Coagulopathies, D, cause bleeding but are less common and usually have other systemic signs. Strategy. NCLEX trick. Firm uterus plus bleeding equals retained tissue. Boggy uterus plus bleeding equals uterine atony. Question 34. Which newborn finding requires immediate reporting? A. Respiratory rate of 40 breaths/min. B. Heart rate of 130 bpm. C. Jaundice within first 12 hours. D. Acrocyanosis of hands and feet. Correct answer, C. Jaundice within first 12 hours. Rationale. Pathologic jaundice occurs when bilirubin rises too quickly, usually within the first 24 hours. This is a medical emergency because it can lead to kernicterus, brain damage. A respiratory rate of 40, A, and HR of 130, B, are within normal newborn ranges, RR 30 to 60, HR 110 to 160. Acrocyanosis, D, is common in the first 1 to 2 days. Strategy. Easy NCLEX rule, early jaundice is dangerous, late jaundice is common. Question 35. During labor, the nurse observes late decelerations on the fetal monitor. What is the priority action? A. Place the client in left lateral position. B. Increase oxytocin infusion. C. Continue to monitor. D. Prepare for delivery. Correct answer, A. Place the client in left lateral position. Rationale. Late decelerations indicate uteroplacental insufficiency, the fetus isn't getting enough oxygen. The first action is to reposition the client to the left side, which maximizes placental blood flow. Increasing oxytocin, B, worsens the problem. Monitoring without action, C, delays care. Preparing for delivery, D, may be needed later but is not the immediate response. Strategy. For fetal distress patterns, remember lion. L equals left side. I equals 4 fluids. O equals oxygen. N equals notify provider. Question 36. Which nursing action is most important when caring for a client receiving epidural anesthesia? A. Place client flat on her back. B. Monitor blood pressure frequently. C. Encourage walking every hour. D. Restrict 4 fluids. Correct answer, B. Monitor blood pressure frequently. Rationale. Epidural anesthesia can cause maternal hypotension, which reduces blood flow to the placenta. Monitoring BP closely is critical. Lying supine, A, worsens hypotension, supine vena cava syndrome. Ambulation, C, is unsafe because of decreased motor control. 4 fluids are typically increased, not restricted, D, to prevent hypotension. Strategy. NCLEX must know, epidural equals hypotension risk. Always check BP and preload with 4 fluids before administration. Question 37. A client in her 3rd trimester presents with severe abdominal pain, a rigid uterus, and dark red vaginal bleeding. Which complication is most likely? A. Placenta previa. B. Placental abruption. C. Preterm labor. D. Uterine rupture. Correct answer, B. Placental abruption. Rationale. Placental abruption equals premature separation of placenta. Classic signs are painful vaginal bleeding, abdominal/uterine rigidity, and possible fetal distress. Placenta previa, A, causes painless bright red bleeding. Preterm labor, C, involves contractions, not sudden pain with bleeding. Uterine rupture, D, can cause pain but is less common and usually linked to prior C-section scars. Strategy. Quick NCLEX memory. Previa equals painless. Abruption equals abdominal pain. Question 38. A woman in the 2nd stage of labor is too exhausted to push. The provider decides to use forceps. What must the nurse confirm first? A. Bladder is empty. B. Maternal blood pressure is stable. C. Fetal head is engaged and at correct station. D. Operating room is available. Correct answer, C. Fetal head is engaged and at correct station. Rationale. For safe use of forceps, the fetal head must be engaged in the pelvis, usually +2 station or lower. Otherwise, use can cause trauma. The bladder, A, should be emptied but only after confirming fetal head position. Maternal BP, B, is important but not the deciding factor. Preparing an OR, D, is only necessary if complications arise. Strategy. NCLEX Pearl, For forceps or vacuum use, first confirm fetal head station and position. Question 39. A breastfeeding mother asks how to prevent breast engorgement. Which response is correct? A. Apply ice packs between feedings. B. Avoid breastfeeding until milk supply decreases. C. Feed your baby every 2 to 3 hours. D. Wear a tight bra to compress the breasts. Correct answer, C. Feed your baby every 2 to 3 hours. Rationale. The best way to prevent engorgement is frequent breastfeeding to keep milk flowing. Ice packs, A. Help discomfort but don't prevent engorgement. Avoiding breastfeeding, B. Worsens engorgement. Tight bras, D. Restrict milk flow and may lead to blocked ducts. Strategy. NCLEX memory, engorgement relief equals warm compress before, frequent feeds, cold compress after. Question 40. A 28-week pregnant woman presents with painless bright red vaginal bleeding. Which complication is most likely? A. Placental abruption. B. Placenta previa. C. Threatened miscarriage. D. Uterine rupture. Correct answer, B. Placenta previa. Rationale. Placenta previa equals placenta covers the cervical opening. Key symptom equals painless, bright red bleeding in the second or third trimester. Abruption, A. Causes painful, dark bleeding with uterine rigidity. Threatened miscarriage, C. Occurs before 20 weeks. Uterine rupture, D. Is rare and usually linked to previous C-sections. Strategy. Easy NCLEX rule. Previa equals painless. Abruption equals painful. Question 41. A client at 28 weeks gestation is receiving magnesium sulfate for severe preeclampsia. Which finding indicates magnesium toxicity? A. Deep tendon reflexes +2. B. Urine output 40 milliliters per hour. C. Respiratory rate 10 per minute. D. Blood pressure 150/90 mmHg. Correct answer, C. Respiratory rate 10 per minute. Rationale. Magnesium sulfate depresses the CNS to prevent seizures in preeclampsia, but high levels can cause toxicity. Key warning signs are respiratory depression, less than 12 per minute, absent reflexes, oliguria, less than 30 milliliters per hour, and decreased LOC. +2 reflexes are normal. Urine output of 40 milliliters per hour is adequate. BP 150/90 remains high but does not show toxicity. Strategy. For NCLEX, memorize, magnesium equals RUD, reflexes, urine, depression of respirations. Always keep calcium gluconate at the bedside as the antidote. Question 42. The newborn of a mother with untreated syphilis should be closely monitored for A. Respiratory distress syndrome. B. Congenital anomalies. C. Congenital infection. D. Hypoglycemia. Correct answer, C. Congenital infection. Rationale. Syphilis crosses the placenta and causes congenital syphilis hepatosplenomegaly, anemia, skin lesions, bone abnormalities, and failure to thrive. A. RDS is linked to prematurity, not syphilis. B. Syphilis does not cause structural defects like cleft lip. D. Hypoglycemia is common in infants of diabetic mothers, not syphilis. Strategy. NCLEX tip, remember torch infections, toxoplasmosis, other, syphilis, rubella, CMV, herpes. They cause congenital infections, not malformations. Question 43. A nurse notes variable decelerations on the fetal heart rate monitor. What is the priority action? A. Place the client in Trendelenburg position. B. Administer oxygen by mask at 10 liters per minute. C. Reposition the client. D. Prepare for cesarean birth. Correct answer, C. Reposition the client. Rationale. Variable decelerations equals umbilical cord compression. First action, change maternal position, side lying, knee chest, or hands and knees, to relieve pressure. Oxygen B may be added after repositioning. C-section, D, is not the first step unless unresolved. Trendelenburg, A, is rarely first choice. Strategy. Use veal chop. Variable equals cord compression reposition. Early equals head compression OK. Accelerations equals OK. Late equals placental insufficiency oxygen and reposition. Question 44. A postpartum woman is diagnosed with postpartum depression. Which statement shows correct understanding? A. This will go away in a few days. B. I might need medication and therapy to recover. C. I shouldn't tell anyone because it will make me look weak. D. This is just the baby blues. Correct answer, B. I might need medication and therapy to recover. Rationale. Postpartum depression lasts more than 2 weeks and often requires treatment, therapy plus medication. A and D, baby blues equals mild, resolves within 2 weeks. C, stigma prevents treatment and is incorrect. Strategy. For NCLEX. Baby blues equals 2 weeks, mild, self-limiting. Depression equals 2 weeks, needs treatment. Psychosis equals emergency, delusions, harm risk. Question 45. A client with type 1 diabetes is 36 weeks pregnant. Which complication is the fetus most at risk for? A. Neural tube defects. B. Macrosomia. C. Low birth weight. D. Cleft lip. Correct answer, B. Macrosomia. Rationale. Uncontrolled maternal hyperglycemia, excess glucose crosses placenta, fetal hyperinsulinemia, macrosomia, large baby. A. Neural tube defects, folic acid deficiency. C. Low birth weight, preeclampsia or IUGR, not diabetes. D. Cleft lip is unrelated. Strategy. Quick recall. Diabetes equals big baby, low sugar, macrosomia plus neonatal hypoglycemia. Question 46. During delivery, shoulder dystocia occurs. Which intervention is priority? A. Apply fundal pressure. B. Flex the mother's thighs onto her abdomen. C. Encourage stronger pushing. D. Prepare for cesarean birth. Correct answer, B. Flex the mother's thighs onto her abdomen. Rationale. This is the McRoberts maneuver, widens pelvic outlet to release the shoulder. Fundal pressure, A. Worsens impaction. Pushing harder, C, is ineffective. Cesarean, D, may be necessary later, but immediate maneuver comes first. Strategy. NCLEX tip, shoulder dystocia equals McRoberts maneuver plus suprapubic pressure. Prohibited, never apply fundal pressure. Question 47. A 34-week pregnant woman reports painless vaginal bleeding. What is the nurse's immediate action? A. Perform a vaginal exam. B. Place the client on bed rest. C. Start oxytocin infusion. D. Prepare for immediate delivery. Correct answer, B. Place the client on bed rest. Rationale. Painless late pregnancy bleeding equals placenta previa. First action, bed rest and monitoring. A. Vaginal exam is contraindicated, may rupture placenta. C. Oxytocin can trigger hemorrhage. D. Delivery may be needed later if bleeding is severe, but not immediate. Strategy. Think, previa equals pause. No vaginal exams, no contractions, bed rest until safe delivery. Question 48. Which postpartum finding requires immediate reporting? A. Lochia rubra on day 2. B. Fundus at the umbilicus 6 hours postpartum. C. Temp 100.6 degrees Fahrenheit at 8 hours postpartum. D. Foul-smelling lochia on day 4. Correct answer, D. Foul-smelling lochia on day 4. Rationale. Foul odor equals infection, endometritis. A. Lochia rubra up to 3 to 4 days equals normal. B. Fundus at umbilicus equals expected at 6 to 12 hours. C. Temp less than or equal to 100.6 degrees Fahrenheit in first 24 hours may be from dehydration. Strategy. On NCLEX, Always sniff lochia questions. Normal equals no foul odor. Bad smell equals infection. Question 49. A client in labor receives opioids for pain relief. What is the nurse most concerned about for the newborn? A. Hyperactivity. B. Respiratory depression. C. Hypoglycemia. D. Jaundice. Correct answer, B. Respiratory depression. Rationale. Opioids cross the placenta and depress the newborn's CNS. Respiratory depression. A. Hyperactivity is not associated. C. Hypoglycemia relates to diabetic mothers. D. Jaundice relates to bilirubin metabolism, not opioids. Strategy. NCLEX key. Opioids during labor. Watch baby's breathing. Antidote equals naloxone. Question 50. A woman in the first trimester reports severe right-sided abdominal pain with vaginal spotting. What should the nurse suspect? A. Miscarriage. B. Placenta previa. C. Ectopic pregnancy. D. Hydatidiform mole. Correct answer, C. Ectopic pregnancy. Rationale. Classic triad of ectopic pregnancy equals unilateral pain plus vaginal spotting plus risk of rupture/hemorrhage. A. Miscarriage usually has midline cramping. B. Placenta previa causes painless bleeding later in pregnancy. D. Molar pregnancy shows grape-like vesicles and very high HCG. Strategy. Quick NCLEX clue, early plus one-sided pain plus bleeding equals ectopic. Treat as emergency. Great job making it to the end. If you've stuck with me through all 50 OB/maternity NCLEX questions, give yourself some serious credit. Every single one of these scenarios, from labor complications to newborn emergencies, could show up on your exam. Now you not only know the answers, but you also understand the rationales and the strategies that will help you tackle similar questions on test day. Remember, NCLEX isn't just about memorization, it's about critical thinking, prioritization, and safety first. If you found this helpful, the best way to keep building your confidence is to keep practicing. Don't stop here, check out my video on NCLEX lab values you must memorize next, because lab values are tested across all systems and are one of the top areas where students lose easy points. Stick with me, keep practicing, and you'll walk into your NCLEX ready to say, "I've got this."